Hi, I'm Dr. Matt Sheehan from Medford Family Chiropractic Center in Medford, Oregon, and it's January of 2018, and I'm here today with my friend Julie to demonstrate a psoas muscle stretch. And if you're coming to us from my website, if you're a patient of mine and you're looking for a little more detail on how to do this stretch, because the devil's always in the details, this is a great place to be. And I just want to hold up a picture of the muscle because it might add a little clarity. We have several pictures here. Can you see that one? Here's a good image for where the muscle is. So basically, if we also focus on this one, you can see here's the low back, the lumbar spine we call it, and you can see that the muscle in red attaches onto the side of the low back bones, right? And then it goes down this way. So as it goes down this way, it's going through the abdominal cavity, the back of the abdominal cavity. And then it goes down, and then it attaches at the lower end on the inside of the hip joint, in the groin. And this muscle is also, this is also part of it called the iliacus. This is on the inside of the pelvis. These two come down and form one tendon. So basically what this muscle does is it's responsible for several things. One thing it does is it's a major muscle to flex the hip or bring the knee towards your chest. So it's very important for lots of activities. It also stabilizes the hip, the ball and the socket in the hip joint, and it also stabilizes or brings L5, the fifth lumbar, down towards the sacrum and kind of cinches it up. So it does several different jobs, and if it's very tight, it can be a major player in causing low back pain, because when it gets tight, I'm going to demonstrate on the spinal model. Here's a side view of the spine with the normal curves, and the psoas muscle from this angle goes from the side of the low back, as we discussed, down this way, and down this way, and it attaches right about down in here, like this. So if the muscle is very tight and you happen to be standing, what it's going to end up doing is it's going to pull the lumbar spine down this way and increasing the curve in the small of your back, kind of like this. So it puts a large stress. It can elicit a large stress on the low back itself, causing a lot of low back pain and irritation and stiffness. And so there's a test we do in my office and many chiropractic and physical therapy offices to determine if the muscle is too tight. And there's ways we can test its strength as well. So if we determine it's too tight, there are a variety of ways you can stretch it out, and we're going to go over one of them today. Julie has not done this particular stretch before, so this will be great. We'll work out some of the details that she needs in order to make this stretch work. And one of the reasons we're going over this today is because this muscle can be difficult because it's subtle. It can be difficult to figure out exactly how to make the muscle stretch for each person individually. Everybody's a little bit different. You got to tweak it, finagle it a little bit to get it to stretch in just the right place. All right? And if you're off by a little with the details, it's not going to stretch at all. You're going to be very frustrated. So I'm glad you're watching this video. Okay, so Julie, what we're going to do is, first of all, we're going to engage your abdominal muscles, your core here, because you want to keep this, you want to keep the curve in the small of the back where it is. How we often will make a mistake with this, we'll cheat, in other words, is we'll find ourselves arching our back and increasing the curve in the small of the back without even realizing it. And that will take the stretch away. It'll make it null and void. You won't feel a stretch at all. So what you want to do is, if you engage your abdominal muscles, your abdominal wall, to keep that curve where it is, when you start to do the stretch, you'll be more likely to feel the stretch. Okay, so you start out there, and during the performance of the stretch, you want to make sure your torso here stays vertical. You don't want to allow yourself to slowly bend forward like this, because that also will take away the stretch. So concentrate on keeping yourself vertical here, keep your abdominals engaged to keep the curve right where it is, and then what you're going to do is the muscle in question, say you want to stretch your right psoas, you're going to bring your right leg backwards at the hip. There you go. So it's kind of like twister. What you're going to do is you're going to concentrate on keeping the back knee straight, and you can lift your heel if you want to, if it's comfortable. You can lift your heel if you're getting too much stretch in your calf muscles. You can lift the heel because it's not going to affect the stretch. And what you're going to do now, actually, bring your leg back for a sec, Julie, and let's have you bring your left leg forward a little bit. Okay, and now bring that right leg back a little bit. There you go. Good. Okay, so this is a good general starting position. So now, once again, straighten the knee there. Lift the heel if you need to take any undue stretch off your calf. Look straight ahead and keep the abdominals engaged. Torso vertical. Good. And now what you want to do is you want to slowly bend the front knee. And what you're going to concentrate on is what's happening in the right groin, on the right side. So this is the muscle that we're stretching, is the leg that's going backwards. Okay? So where Julie wants to feel it is more or less at the level of her hand, right on the inside of her hip. And it's a small area right where the muscle attaches. That's typically where you're going to feel it. It's not going to be, if you're feeling it more all the way down the thigh muscle in the front, then you're stretching the wrong muscle. You're stretching the thigh muscles, but not the psoas. So you'll know it if you're stretching it in the right place, because it'll be about the size of a quarter right on the inside of the hip. And so are you, Julie, in real time, what are you feeling right now? Are you feeling anything in where your fingertips are, right around the edge?
I am. Good. I feel a little stretch there, and then some actually kind of right up into here.
Good, good. Yeah, that's perfect, because that's also stretching the iliacus muscle, okay, which again attaches with the psoas right on there. So at the point where you start to feel a stretch, again, not a severe stretch, you just want to slowly bend that front knee until you start to feel the stretch there, and you can hold it there for 30 to 60 seconds. And as it relaxes and that stretch sensation starts to ease up, allow yourself to sink further into the stretch, meaning allow yourself to bend that front knee a little more to maintain the feeling of a stretch on the right groin for the full 60 seconds. And again, ways that will cheat, not cheat, but will nullify the stretch is we'll find ourselves, watch what Julie does. She'll lean forward a little bit. What happens when you do that in terms of the stretch?
It eases the stretch.
It eases up right away. Now try this. She's still vertical. Now if you were to arch your back and stick your belly out and kind of do that, do you notice anything?
It changes
it. It changes it right away. And also, if you were to bend this knee,
it also eases.
There you go. See, there's so many ways that you can screw it up and not even know it. So glad you watched this video. Those are the major ways that you would make a mistake with this. Okay, there's that one. That will help you a lot with the psoas. Thanks.
Okay.
Good.